Obstructive sleep apnea is not just snoring. And snoring is not something that you should kick to the side. It's not even something you should make fun of someone about, because snoring could be a sign of a serious medical problem, obstructive sleep apnea. And we're going to look into the complications of obstructive sleep apnea. But before I go on, I'd like to introduce myself. My name is Dr. Arnold Kute. I am triple board certified in internal medicine, obesity, and sleep medicine. My channel is about giving education on common sleep problems and what you can do about them. So now let's dive into snoring and obstructive sleep apnea. I'm going to start by explaining what snoring is. Why do we hear that sound? It is a sound that is generated by the upper airway typically. And this could be a sign of sleep apnea if it is linked with other things like daytime sleepiness, early morning headaches, daytime tiredness, multiple nighttime awakenings, and memory and concentration problems. So what are the problems with sleep apnea? Why is there so much noise about it? Well, I don't know if there's so much noise about it. What I want you to understand that if you have sleep apnea, you are having multiple awakenings because you're not getting oxygen at nighttime. Now, some of those awakenings you don't even know about, some you may know about, but most of the times you're not aware of it. And so you're not getting oxygen to your different body parts, and the brain protectively wakes you up to take breaths. And these are long pauses of at least 10 seconds. And over time, because the body is not getting oxygen, the tissues, the organs, different body parts, there will be complications. And so I'm going to delve into those. I listed about 10 things that can happen long-term if sleep apnea goes untreated. The first complication that I'd like to talk about is strokes, CVAs. Now, I get a lot of referrals from neurologists after a stroke, and we typically commonly find sleep apnea in these patients. So if you are a neurologist and you see patients with an acute stroke, you want to have them have a sleep study as soon as possible. And so having untreated sleep apnea can lead to stroke, and patients that already have strokes are at risk of having sleep apnea as well. So definitely something for you to check out. And so this is one feared complication. No one wants to have a stroke because there are a lot of morbidity and mortality associated with strokes. Now, the second thing is motor vehicle accidents, right? As not all common as this may be, this is very dangerous. It is typically dangerous for you to drive when you are sleepy because you could hurt yourself, you could hurt other people. People can die in an accident. And so treating obstructive sleep apnea can keep you more awake, alert, and so you can avoid going into or having a motor vehicle accident. Number 3 is hypertension. Typically get a lot of referrals from nephrologists for uncontrolled hypertension, and most of these patients end up having sleep apnea. So I'm talking about patients that are on 3-4 medications for elevated blood pressure and uncontrolled hypertension, right? And so treating sleep apnea helps them to have a better control of their blood pressure. And the fourth one is diabetes. Having uncontrolled or untreated, untreated obstructive sleep apnea can lead to problems managing blood sugar. It can cause insulin resistance. And so this is one thing that can happen if you have untreated sleep apnea. You are at risk of developing diabetes. If you already have diabetes or you're an endocrinologist taking care of patients with diabetes, it is crucial for you to test them for sleep apnea or refer them to their PCP or the sleep medicine doctor if they have symptoms like snoring and daytime sleepiness and all of those things that I listed earlier. Because treating their sleep apnea, if present, can make for better control of their blood sugar. The next thing on the list is myocardial infarctions. Yes, cardiovascular problems. And this can happen. Again, what you want to think about is that the body, the heart, is not getting oxygen. So the heart is stressed, and that can lead to myocardial infarction. The next item on the list is atrial fibrillation, right? So irregular heart beatings. So this is very common, and in fact, these patients are at risk of both obstructive sleep apnea and central sleep apnea. And so I take these patients really seriously when I get to see them as referrals from cardiologists. And why it is also important to really take care of these patients is because together with atrial fibrillation and untreated obstructive sleep apnea, they are at risk of a stroke. So I don't take them lightly. I make sure that they're well taken care of. They get a sleep study as soon as possible and treat sleep apnea if present. Next item is dementia, and this is long-term, right? One of the symptoms of sleep apnea that people complain about is memory and concentration problem, and that's typically how it starts out, right? Fogginess during work hours, just being unproductive, not being able to concentrate, and long-term. And why long-term dementia could occur, and why is this? This is because when we sleep or during sleep, the brain takes the time to detox, right? Take care of toxic substances that build up in the brain, like amyloid proteins and all of that. And if there is sleep apnea, the body is not getting good, refreshing sleep, and so long-term can lead to dementia. Next is pulmonary hypertension. Again, the vessels of the lung are stressed because not enough oxygen, and over time they begin to enlarge, increase, and that can lead to pulmonary hypertension. And I do get referrals from cardiologists for this all the time, from cardiologists, pulmonary doctors as well. And eventually from pulmonary hypertension can lead to heart failure, and that's the next item on the list. And so this is a complication of untreated sleep apnea, heart failure. Doesn't matter what type of heart failure, they are at risk of heart failure. They, alike with those with atrial fibrillation, are also at risk of both types of sleep apnea, central sleep apnea and obstructive sleep apnea. And the last item, but not the least, is death. Yes, that can happen. People can die in their sleep from untreated sleep apnea, can die from all of these complications that I listed earlier, can die in surgery because general anesthetics can further worsen upper airway or cause up the upper airway to relax more, and so lead to more obstructions. And so all of these things, I think there were about 10 things, complications of untreated sleep apnea, and this list is not even exhausted, right? This is it's unlimited. The symptoms, the complications of sleep apnea that I listed here are not limited to these. There are many more. Ophthalmologists are adding things like macular degeneration. So the way you want to think about this, think about sleep apnea is this: your every organ, every tissue in the body is not getting oxygen, period. And so eventually the body will start breaking down, and these are the manifestations of that. And so if you snore, or you know someone who snores, please let them know. Some people don't even know they snore. I had a patient recently that came to my office, and she told me, do you know that I've snored all these years and I never knew? I only found out when I got married and my spouse told me that I snore. So some people live alone and they don't snore, but you go out on vacation or camping or things that bring people together, and you find that your friend or your neighbor or someone is snoring. Don't fail to tell them. Tell them so they can get tested because of all these complications. And if you're a physician and you're taking care of any category of these patients that I have listed, you're a general doctor, cardiologist, a neurologist, a nephrologist, a pulmonologist, please look out for your patients that might have signs and symptoms of sleep apnea and have them see a sleep doctor to get tested or to take care of their sleep apnea. Some people get tested, know they have sleep apnea, but they don't want to treat it. I want you to look out for all of these types of patients and educate them so they can get treated. And I think that's all I have for today. Thank you for watching. Please share this video to all that you think might need it and might be helped by this. See you in my next video.